I'm heading up to Eisenberg 8G, the Infusion Therapy Center, where I'll get my Xolair injection for chronic urticaria, or as known to other people, hives. So every 3 weeks I get the Xolair for the chronic urticaria. When I first started it, I got it every 4 weeks, but I noticed that in that third week, heading into the fourth, it was wearing off, so we switched to every 3 weeks, and it's been much better. This is the waiting room up here. So they got this little area. And then if you go over here, they have a bigger spot. I can show it today because it's the weekend. And on weekends, they're slower. So that it's not filled with patients. Because I wouldn't obviously show it to you if it was full of patients. You head down there to a different unit. I just love that. Isn't that beautiful? I love the artwork they put in. Sorry for the glare from that light up there, but that's just gorgeous. So then a full 360. That's the check-in desk. So during the week, they have secretaries that work at the check-in desk, but because the weekends are so slow, they just have a phone put out, and you pick up the phone, and it calls back to the nursing station, and you just let them know that you're here, and then they come out and get you. But during the week, it is busy and bustling here. The nice thing is it is open 7 days a week, 365 days a year, rain or shine. I think from 7 a.m. to 11 p.m. So it just helps to prevent you from having to go in the hospital for something that you can do outside of the hospital, and then you can go home and not have to worry about a hospital stay. I got checked in, and the Eisenberg 8G has like 3 different pod areas. So I got checked in, and they put me over in the pod over there. They're like circular units, that's why I say pods. But then since I was the only person over there, they decided to close that pod, meaning instead of staffing that area and have 2 staff over there for 1 patient, try and keep everybody over in this pod, and it just works out better for staffing. Sorry, that's not really clear and doesn't make sense. It makes sense to me because having worked at Mayo Clinic as a nurse, I get it and I understand why they're doing it, but it's sort of hard to explain. So anyways, so then I got moved into my new room, so that's where I am. Currently waiting for the Xolair. They don't make it until you're here because it is a very expensive med, and if for some reason I don't show up, then it goes to waste. So that's one way they try and keep costs down, is by not making it until I actually get here. And so that's what I'm waiting for. I did get pre-medicated with Tylenol and IV Benadryl, and so now I'm just waiting for the injection. They always write the plan up on the board, so in case another nurse answers the call late, they know what's going on. So like the time I got the Tylenol, the time I got the Benadryl, the time I'm going to get the Xolair, then I have to wait 30 minutes after that just to make sure that I don't have a reaction. And then I get my vital signs, that's what VS stands for, and then I can leave 30 minutes after I got the Xolair. So since I haven't gotten the Xolair yet, that's blank, and I don't know when I can leave because I don't know when I am going to get the Xolair. The very first time I got Xolair, I think it was, or maybe the first month or 3 months or something like that, I had to wait 2 hours to make sure I wouldn't react. But now, because I've been getting it so long, I only have to wait 30 minutes. However, with this drug, you can have a severe life-threatening reaction up to 24 hours after receiving it. And because of that, I'm required to carry an EpiPen with me for 24 hours after I receive the medication, and I have to bring it with me here just in case I have a reaction up here. I don't have the full thing shown just because it has my name and clinic number and stuff on the bottom on the tag. But yeah, so that is what I'm doing. I'm just going to hang out until I get my injection. And then the first IV try, she wasn't able to get it, but then she got the IV there. That's normal for me because of all the medications and IVs and everything that I've gotten because of transplant and now the Xolair. My veins are pretty much shot, so sometimes it can take a while to find a good spot. Sometimes it can take maybe 6, 7, 8, 9, 10, 11, 12 tries. So for her to not get it the first try but get it the second try, that's actually really, really good, just because of how bad my veins are. As you can see, I got the Xolair injection at 15:35, which is 3:35, which means I can leave at 16:05, which is 4:05. I didn't record it just because, for privacy's sake, for the nurse and stuff, I don't want to record her giving the shot, because I don't want to show her and what she's doing. I don't know, just privacy's sake, I don't think it was a good idea. So I just got the injections and I'll chill out and wait. Ryan and Maddie went to run some errands, and then they're gonna come back and pick me up when I'm ready. So I finished the time frame for the Xolair injection, had no reactions. They asked me if I was okay. I felt okay. They did my vital signs. My vital signs turned out fine. So they took the IV out, and now I'm heading to the car and where Ryan is, because he dropped me off, and Maddie and him ran a few errands, and now he's picking me up. Good thing he called me to tell me that he was here to check in on me, because I was just sleeping away, and I could have been sleeping away for hours up there. But anyways, so Ryan's here, and he's right there, not sure if you can see him, and I'm gonna hop in the car and we're gonna head home.